What exactly are ocular migraines? I'm Dr. Rupa, a board-certified ophthalmologist and migraine sufferer. Let's explore this complex condition together. When we say ocular migraine, we can mean one of three things: a migraine with aura, a retinal migraine, or an ophthalmic migraine. Let's break it down. Visual auras can be mesmerizing yet confusing. You might see shimmering lines or sudden blind spots. These are your clues. A migraine with aura often presents temporary visual symptoms, like zigzag lights or blind spots, lasting less than an hour. Understand your signs. Retinal migraines are serious. They can result in vision loss in just one eye and may indicate more severe conditions like a mini-stroke. Ophthalmic migraines bring visual symptoms without headaches. Yes, it's a genuine condition, often overlooked but real. Eye pain from migraines? It's often due to the trigeminal nerve, which supplies sensation to both your eye and brain, so everything's connected. Have you felt that pressure around your eye? You're not imagining it. There's real biology at play here affecting your vision. What triggers your migraines? It could be aged cheese, hormonal changes, stress, or even dehydration. It's time to identify your patterns. Did you know there's a link between migraines and dry eye syndrome? Migraines can manifest alongside dry eyes, hinting at deeper issues. Treating dry eye may actually help reduce the intensity of migraines. A small but significant connection worth exploring. Treatment options range from over-the-counter meds like ibuprofen to triptans and monoclonal antibodies. Find what works for you. Triptans can effectively target migraine pathways. Your next dose of hope could be just a conversation with your doctor away. Monoclonal antibody injections represent a new frontier in migraine treatments. Talk to your physician to see if it's right for you. Don't underestimate the potential of beta blockers or antidepressants. Every option counts, so get personalized advice. Feeling overwhelmed? Remember, you're not alone in this journey. Many share your struggles, and help is out there. If you're experiencing unusual visual symptoms or migraines, don't panic. Seek medical advice to clarify your situation. Thanks for watching. Hit subscribe for more insights and support in managing ocular migraines. Join our community. Take a deep breath and remember the journey to understanding your health is a step worth taking. You got this. Every migraine has a story. Let's tackle yours together. Share your experiences in the comments below.